Hello everyone, this is Chadi Alraies from NCVH 2025. I'm really privileged to be with Dr. Kenneth Rosenfield, who has been a phenomenal operator in the PE, intervascular and coronary, but we have an NCVH now to talk about a very important safety and wellness topic related to radiation. Kenneth, thanks for being with us.
Thanks for meeting with me. Good to see you, Chadi.
Yes, thank you. So this is a very important safety issue, radiation.
Yes.
So tell us, the audience, a little bit about the concern of this, our profession and exposure to radiation.
Yeah, well, this is something that that most of us have not really paid a lot of attention to. I know that early in my career, and I've now been in this for over 35 years, I thought I was immortal and I would never be affected by these things. And I was a go-getter, jump in head first and do as many complex cases as I could and spend as much time with the patients and trying to open up arteries and so on. And now, this many years later, I've personally experienced some issues with my back, and also had colleagues who've had a lot of issues with orthopedic concerns, and also one of my partners, Chip Gold, who was a sort of an iconic guy who spent a lot of time early on in the PCI days, actually developed leukemia and passed away from that, which I'm sure was related to overexposure to radiation. This is a real issue. It's become real to me. I lost, last year I was out for 24 weeks out of a total of, during the year. And that's a lot of time. It was related to a back injury and discectomy and another operation after that. So this is a profoundly important topic for us to protect ourselves and our staff. And it's come full circle to me, and I realize how impactful this can be. So the good news is that we now have ways to mitigate against the effects of radiation, and also to lighten the load so that we don't have to wear as much heavy lead on our backs. And so I've become pretty passionate about this now. I think preserving our workforce is really important in terms of keeping us healthy will enable us to keep our patients healthy.
Yeah, I agree with you, Kenneth. I mean, as we get more in career, more radiation exposure at some point is going to hit either, as you said, ortho or cancer or something else, or cataract. So, but the resources we have now, like EGNES, Portigo, the new development and the technology about radiation, it's not available in every lab, and the problem administration don't see the return of this. So how we can convince them?
This is I think ultimately they will come around. It will take us coalescing and making our administration and our hospitals recognize the importance of preserving the workforce. For example, my being out for half of the year last year, when I'm generating 16,000 RVUs a year, and now suddenly that's cut in half, that makes a big difference. And my colleagues had to work double time to support my being absent.
And losing your expertise, that's like also very valuable beyond our views.
Right, exactly. And it costs a ton of money to invest in training people, not just physicians, but nursing and technicians, technologists. And when you lose them because of chronic backache or more disability or cancer, even worse, then it's a real issue. It's a loss of resources. So I think it's important. I mean, in every other walk of life, if you're on a work site, OSHA's watching to making sure that you are, there are regulations about work site safety. Yet we somehow or other have escaped that because we're mostly focused on patient care. So it's important. I think the devices that are coming out now, first of all, I have been using Rampart in my lab for the past 2 or 3 years. It hasn't worked for all cases, and we have some issues with technical, breaking down every once in a while. It doesn't, and I'm the only one in my lab who's not wearing lead. Everybody else has got lead and they're walking around, and because they seem not to be protected. So there's some issues. I think that device has gotten better, and the newer iteration of that is better. EGNES has also done a very good job of trying to protect everybody in the room, wearing lighter lead, which is a good thing. I actually have a relationship with Radiaction, which is another company which has a different type of solution. It's one where they stop radiation at its source. These are shutters that are attached to the actual image intensifier and the X-ray tube, and they come up and down with a number of sensors that they come down to the patient and stop at that point because the sensors tell it to stop, and so it protects you at the source. So the key is there's certain sort of tenets that we need to that underscore these new devices, and one is that it has to protect everybody in the room.
Yeah.
I think that's really important because our nurses and our techs are also really vulnerable, and all of them have issues too. More than 50% of them have back pain.
Absolutely.
And so second tenet, it should be amenable to our workflow.
Yeah.
It has to allow us to not have to stop, and has to let the rooms keep going and move through the pace of the day without actually interfering with our workflow. Number three, it has to be, again, sort of user-friendly, and has to be basically, I'm blank on what the other tenets, but they basically has to protect everybody in the room and be easy to use and be flexible and sort of instantaneous.
Absolutely.
So
the one last comment I'd like to have from you is, as you said, you were invincible, you want to do everything.
Yeah.
Everybody graduating right now have the same drive, right? I want to jump in head first and do stuff, and then we don't realize and damage happen. And we know a lot of people from Sky and other very luminary people like yourself have major issues, and ortho mainly.
Yeah.
So how I can balance between the pressure of the, as you said, work, get the RVUs, and then not to do too much and lose my passion that I signed up for, and then control myself to save myself. Like how, what's your advice?
It's a great question. Well, first of all, we need to train our trainees and educate them about the importance of this. I mean, it's astounding to me, Chadi, that I speak to half of the interventionalists that I speak to, and by the way, this is not just interventional cardiology, it's radiology, it's neurosurgery, it's orthopedics, all of our colleagues in other specialties that also suffer from these same issues because they're exposed to radiation and they have to wear lead, and they're standing and contorting their bodies in different ways. Yeah. So we need to educate them better about the importance of maintaining physical fitness, just doing basic things in the room like framing out the X-ray so that they, bringing in the cones to the edge of the image so that you don't have as much scatter radiation. Stepping back, taking 1 or 2 steps back saves you a ton of radiation, because of the way the radiation works in terms of being exponentially higher when you're closer. So those basic things are important, and just making them part of your daily routine. It just should be automatic. Those should be automatic. And exercising, maintaining your core muscles is critically important. And then, again, the devices that we concoct to deal with this need to go with the workflow. They need to be natural and make it easy so that they're just part of the environment. Yeah. And I think that's the ultimate goal. That we're not quite there yet. I think all of the devices that are being developed are becoming more and more part of the workflow. That will be ultimately the thing that discriminates the winners and losers, is the things that are actually working with us to make our systems work better. There's another device called the G-Lift, which I hadn't known about, but turns out 2 or 3 other people in my lab are using it already. It's a device that goes around it's integrated into the lead, and it puts all the weight down on your hips and has these support structures to keep the weight off of your shoulders, translates it down to the hips, which is a better place. That's transferring the weight of the lead down to where it needs to be. Okay. So I'm probably going to get one of those. That's a company called Salus Medical. But I think all of these things are moving forward, and I think it will become part of the culture, honestly, to your question. And once it's part of the culture, people will be interested in preserving their longevity and their well-being Many people, if you look at the data from the surveys from Sky and from ACC, many people are actually cutting short their careers. Not just taking time off to have operations like myself, but actually cutting their career short because of this. And their quality of life is affected. We need to just message that repeatedly. And as a senior person, it's incumbent upon me to convince junior people like you who are well into their careers that your longevity will be affected, and you're not immune to it.
100%. Well, Kenneth, thank you so much for a very, very insightful interview, and also options and awareness of the problem that we should be aware of. Watch these videos and others on the YouTube channel of NCVH. This is Chadi Alraies coming to you from NCVH 2025 New Orleans.
Thanks, Chadi, for the opportunity.
Thank you.